Hi there, chaps. We have this guest second time round now, isn't it? He was on about a year ago, but this is a qualified doctor and all of that kind of stuff. But we wanted to have a natter just to what's the word I'm looking for? What's the word I'm looking for? With MANUP, we always find when people contact us, it's just they'll all say that life's in a bit of a pickle, and I totally get that. We've all pretty much been in different situations around that. And also, have you spoken to your doctor? And it's normally two things like, no, doctors don't want to do anything. They just want to pump me full of drugs, which basically normally means, no, they haven't. And the other ones are just like, oh, they keep, what's the other one I keep getting now? It's, oh, they keep referring me off onto different services and dumping me off. I'm like, well, so I just want a bit of a natter about that, if I may. But before we crack on though, I'm going to just, I actually have COVID, so I might end up having a little wheezy fit through this video, so I do apologise on that straight away. So, well, what's your views on that? I'm going to let you take the lead, as you're the qualified one. I'm not.
Okay. Well, I have several points of view on this. Mostly, doctors try to fill you full of drugs. Well, sometimes drugs do work. Most times they do work. And if you need medication, actually, A, you have to take it for it to work, and B, you have to take it for long enough before it starts working. And yes, most pills have side effects, but sometimes the side effects are not as bad as the benefits. So that's one thing. Now, somebody used to say that, oh, doctors, all they want to do is give you pills. Quite a lot of the time, that is all they have. Because, for example, if they need to refer you on to other services, those services are overstretched or have not enough people to support, and therefore they have long waiting lists. So in the meantime, what can they do? If they can support you with some medication, even though if it's only in the meantime, you will feel better. Yeah. You just have to give it a chance. Now, the third thing is that you say, oh, doctors just fob me off and send me on to different services. Not everybody, not all the GPs or doctors are or have interest in all different treatments and conditions. So if they are not particularly versed with this, or if they don't know how to deal with it, they will ask for a second opinion, which is what then happens. You get referred for a second opinion. And in some places, the only way that you can actually get some proper and appropriate treatment is to be referred by the appropriate route. Now, I used to be quite frustrated when I was working that these routes do tend to change. So one year we had, for example, our community psychiatric nurse in a hub sort of in town. The following year, they were all divided and we had one per practice, which was fantastic because firstly, you could go and talk to the person, you could discuss cases, and they would give me advice, and then I can get on and deal with things. But then they were removed from the practice again, and we've lost that rapport, and therefore we can just refer on without being able to discuss the case. So I think that those are my answers to those couple of questions, really.
It sounds like I don't want to put you in a horrible suit. I don't mean how that sounds. So it sounds like you guys are chasing your tail just as much as public are when it comes down to. And yeah, again, I'm alive because of the NHS. I really am. I'd never ever slag it off, but it does sound like, we'll Google it. You guys are quite clearly chasing your tail just as much as everybody else. And obviously COVID hasn't helped with that really. So
but the other thing is that quite a lot of the time there's a new government or a new health minister, and they want to leave their mark and they want to change things. So the established pathway that you had, for example, for a certain condition referring to such and such department, and they will be seen, and etc., the pathway has changed. And then we have to learn a new pathway, because if you referred by the old pathway, it just gets bounced. Therefore, there is another delay for the patients to be seen. And that is extremely frustrating for us, because I can't remember, all the different departments in the hospital. I can't remember all the time, who do I have to refer to, or which way. And yes, quite a lot of it is now automated, and we had a fantastic secretary who knew all these things and knew as they came in, so she would point us in the right way. But for us, that is a frustration, because it takes us away from dealing with patients, really, because you have to think, oh, okay, I have to think about for the next 2-3 minutes, who am I gonna refer to, and that just wastes my time. That's the stuff that you shouldn't be asking of a highly paid professional. The nurse don't necessarily have to refer people via this pathway or that pathway. Actually, it's an admin job, and quite a lot of these admin jobs have been shoved onto the general practice from the hospital. So therefore, the hospitals don't have necessarily the secretaries, for example, to receive these letters. They have one multiple secretary, and we had to then employ our secretary in order to divide all this, send them in the right place. But that's just my moaning, I guess.
It's sad to hear it, because it is sad to hear it. But I think now I kind of get it, because I've been there with my doctors a few years, not that long ago, a couple of years ago, and they're just like, you need to have these antidepressants. I'm like, no, they make me feel crap. I've had them. It's like, how long have you been taking them? 3 days. You could, I know, and I've been there. I'm happy to put my hands up on that. I've been there. Now I'm getting really arsy with the doctor, because I know better than the doctor. Then you kind of get that, and then I remember this doctor. She was lovely. She was like, "Well, go onto this website here." I think it was like Suffolk Wellbeing or something like that. It was like, just refer yourself. And I remember at that time, it did make me. I remember going home to my wife, just thinking, these doctors are crap. It's like, why didn't the gatekeepers call? Why didn't the gatekeeper just tell me to do all that? But now, actually, funny enough, interesting what you've just said. Actually, it is quicker for me to actually self-refer myself. I feel really bad now.
But it's the communication again. You didn't know that that's the way we are now being forced to do this, and that may have changed since last time you've been to the doctors. And it probably has, because one department, it's the same thing. One department had changed, and then all of a sudden it becomes not just East Suffolk, it's East Suffolk and Northeast Essex. And then another thing, it's like an amoeba, sort of morphs, and comes up with these new improved way, which actually are not improved necessarily, because nobody asked the person on the ground what would be the best way of dealing with this. And by the person on the ground, I don't necessarily mean us GPs, community psychiatry nurse, or a matron, or even the patients who have been through this journey, and they come back to you and say, well, this was rubbish, this was rubbish, this was rubbish, but actually, eventually, when I got to this, that was helpful. And that is a bit of a problem. And the other thing I would say is, again, it comes to the communication between the GP and yourself. Because if I'm trying to talk with you about the possible treatment, etc., I have to give you the knowledge. At the end of the day, I don't make the decision for you. It's for you to make the decision. I'm only there to try to help you make the decision as an informed choice. So, for example, if somebody gives you antidepressants and doesn't say, oh, for the first 2 weeks, all you get is side effects, you think, well, after a couple of days, I'm feeling bloody awful, and I haven't got any benefit yet.
I've been,
Well,
yeah,
antidepressants take a minimum of 2 to 3 weeks to start kicking in. And until then, all you get is side effects.
yeah,
Um, so, for example, I used to sometimes give people a very, very small dose, so they had minimal side effects. But then they also did not particularly, 2, 3 weeks down the road, get particularly good results. But at least when they got used to the side effects, we used to increase um, the dose slowly so that they wouldn't come to the conclusion that these pills are just poisoning them and giving them side effects without any benefits. So it is the communication between the patient and the professional. And these questions, the patients don't always ask them. We also know that as doctors, we are usually the last people who the patients come to, because they're going to ask their mate down the pub, they're going to ask their wife, they're going to ask their granny, they're going to ask their aunt, they're going to ask their neighbor. And if all those things, you get 5, 6 opinions and you're still not sure, well, then you may either ask the receptionist when you come in, or the nurse, and then eventually the doctor. So we know that quite a lot of the time we are the last port of call.
that surprised me. So before they've actually come to the qualified person, they've had about 5 other diagnoses from people who don't know what they're talking about, quite frankly.
Well, and also you mentioned the G word, Google. You got symptoms, you Google it. Quite a lot of the time there is some good stuff on Google. Quite a lot of the time there's a lot of rubbish. It's a bit like going to Wikipedia for something.
Yeah.
It's not quite the same as a medical degree.
Yeah.
And therefore, unless you're looking for a specific answer to a specific question, you don't necessarily know what question to ask of the search engine. So you may, when you, for example, when you read the prescription leaflet, all the side effects are listed, even if they're minor, including death. Well, as a doctor, I would not really give you something that will kill you.
Yeah.
But the manufacturers have to put that down because little Johnny or Freddie, took this once, got run over a bus, and therefore that may have resulted in his death. Who knows? But they have to protect their own backside, and that is why. That's why at times I tell people, just don't read the leaflet, because if you don't read the leaflet, you are unlikely to get the side effects.
Yeah, that I see. Yes, it's that whole. Is it a placebo? No, what's that word? When because it. Yeah, I know exactly what you mean. Because I remember I had a tumor in here and they cut it out.
Yeah,
I don't know where I go this one, but I've decided on that. But I remember. I knew about this tumor for ages, but they said it was like a lymph node. Don't worry about it, so I ignored it. But it got me. To be fair, it did get quite serious. But the minute I went into this special thing, I think it was Colchester, they were like, actually, they were like, oh, actually, yeah, this is kind of serious. So we're going to book you in. We're going to basically chop your head off and get it out. And from the second I knew that it was serious, I had pins and needles in my arm and all of this down, all down here. Like a second, it was totally, that was my head, completely and utterly playing about it. But anyway, I don't know what's going with that one, but yeah, I know what you're saying. It's just,
well, I think where you were going was that you actually went and saw the specialist, and quite a lot of the time, you may have had the lymph node for a while, and you think, oh, I'm not going to bother doctors, so it's all fine, fine. But actually, sometimes you probably need a second opinion, and when your other half, for example, is worried about this, and she's thinking, I'm worried about that, and if I ask him to go and see a GP, he'll say, oh, it's nothing, and refuse. So there is a way of trying to get the man to go and see the GP so that he can be reassured or she can be reassured. Now, this happened to me recently. I have just had unfortunately, I had a COVID around Christmas, and about 4 or 5 weeks later, I started on some new treatment because, I had real problems with my chest and I was short of breath. Now, the last 5 or 6 weeks, my voice has changed, and you can tell that I'm a little bit husky, and I keep clearing it. So my wife was worried about this, and she was thinking, well, shouldn't you maybe go and see your GP about this? And in the end, I wanted to make her feel happy, and I decided to go and see the GP. And GP put all the plugs and said, oh, you had more than 4 or 6 weeks, you've got to go on a 2-week wait, which means suspected cancer until proved otherwise, et cetera, et cetera, et cetera. So I went to see the GP, and I've got all the bloods done, chest x-rays. Then I had my appointment within 2 weeks. I went seeing the consultant, and the consultant was really reassuring, got all the results, looked at them, did a further examination, and then explained to me, okay, this is all fine, you haven't got cancer, etc. And then explained to me and did a little bit of investigating work about why this could have started happening. And it sort of narrowed it down to the new medication that I started for my breathing. Okay, that is probably what has affected my throat. So not only was I sure that I didn't have cancer, I also came up with the answer of why it probably has happened. And thirdly, and most importantly, I made my wife happy because, I'm looking after myself, because, at the end of the day, she worries about me. And if I would just say, no, forget it, I'm stubborn, I don't need to go, she'll be unhappy. And she wants to look after me, and I want to make her happy, and that is why I went. So where I'm trying to go with this, can you just hold on for 1 second? I'm just going to, yeah. And they're recording. Okay, thanks. Sorry, Dan.
That's all right.
Sorry.
Never had anyone do that before. But no,
well, hoovering next door, so
okay.
I didn't want the sound.
You're at work, are you?
Yeah, I do have Wi-Fi. Yeah.
No, sorry. Are you at work at the moment? Are you at the surgery?
No, I'm in my office.
Oh, right, okay. Because I think you've already. Oh, excuse me. I think you've already answered it up to a point. Because one of the other things I get, funny enough, on Instagram more than anything else, is like my fella's doing my head in. He's clearly depressed, which probably goes back to that other people diagnosing you.
Yeah.
Can't get him to go to a doctor. I think you've already answered. Have you for the women out there, I know that's probably not the most PC thing, is if they want to get their fellow who's clearly stressed, depressed, whatever, to actually just go to a doctor, what would you say to them? Even though I think you've already answered it, to be honest.
I think at times it's really difficult because men don't want to seem weak and admit, oh, I'd better go and see a doctor for whatever reason, whether it is that he's depressed or has got a new mole on the back, etc. And actually having a new mole on the back is much easier for them than to admit that they can't really cope, or they're anxious or stressed. So because they are stubborn, proud, whichever way to you want to call it, they will refuse or subconsciously refuse to do this. And therefore, I think for the ladies they have to use their femininity and their guile and to make sure that the men understand how much they're worried. Yeah, if as a woman you go to a man and say you should go to a doctor, he'll say, oh, off you go. I'm not interested. But if they mention, look, I want you to be healthy with me, and I really want to be together, and I'm worried about your aspect of your health, and I don't really know the answer. You might not know the answer, but a GP may know the answer, and it would make me really happy if you might be able to go and find out. And men want to keep their women happy. I
Yeah.
think I do, and look after them. And if my wife comes to me and says, "Look, I'm worried, therefore I'm really unhappy, and I will just carry on worrying. Perhaps if you want to look after me, be really kind to me, could you go and see your GP?" And I think that is probably the best way to approach this, because if men don't want to do it, they're stubborn, and I'm one of them, and I know that.
Yeah, exactly, isn't it? It's just taking the stress off of somebody else, isn't it?
Mm.
I
Yeah,
think that really is, and I'm quite lucky with Faye, my missus. She's just like she'll literally drag me to the doctors, because she's just
but
like you're stressing me out and causing her anxiety. So
yeah, but also you let yourself being dragged.
yeah,
Not everybody does that, So it is important to sort of have more than just one approach,
yeah, absolutely. That was a good.
because the worst that the doctor can say is, "I've examined you, done some blood tests, you're fine, off you go." Great,
Yeah.
then you're happy, nothing wrong. She's happy, nothing's wrong.
Yeah, absolutely. Because
And
funny enough, actually, because one of the things, and I'm really bad for it. I never want to waste a doctor's time, and I think that's something where, especially more so with blokes, just in my world, before anyone parts, just in my world, it's like, oh, don't worry about it. It'll be fine. I'm not going to waste their time. And I'd say if I can be quite dramatic, well, it's not dramatic. It's true, because I've seen it a few times, especially because of COVID. That cough and stuff like that, what's been there for a long time, they've now got lung cancer. I didn't want to end the call like that, but it's because they were like, no, it's fine. I might have had COVID like last year, and thanks.
Yeah.
I don't think any doctor mind you wasting their time.
That's number one. You don't waste their time, because that's what they're there for.
Yeah.
They're there to examine, give you advice, make sure that you are okay. And number two, things do change. You may have had COVID this year and you had a cough, but actually, 6 months down the road, who knows? It may be something completely different, and it may be the cancer or asthma. And the other thing about the COVID, it's just such a new and confusing disease that people who had COVID with mild symptoms or whatever, 12 months later, they end up with having scarred lungs. And you just think, well, I wasn't particularly ill, but all of a sudden my lung function is half of what it used to be. I've never suffered with asthma, but now without the inhaler, I'm really struggling, so much for my being able to dive, etc., and have a really good lung capacity because I swam a lot. Actually, unless I use my inhaler, I haven't got the stamina that I used to have before. So yeah.
Thanks for that while I've got COVID. Thank you very much. Cheers, buddy. But no,
I just wanted to cheer you up. Yes.
Yeah, no. Thanks for ending the call on that. But no, it's all good. But no. But so I think that just before we do draw to Claire, I think you just answered it. So say, what's the one thing somebody can do to help you? So say, for example, I don't know, doesn't really matter the gender. They've come in, and all you can do at that moment in time is go, I'm going to give you antidepressants.
Mm-hmm.
What's the one thing they can do? I already know the answer, but maybe people hearing it from a doctor. What's the one thing they can do to help you?
Sorry, what is what? What is?
Sorry. I'm just. Let me rephrase that one. So I apologise. So if somebody comes in,
you broke up.
Oh, sorry. Can you hear me now?
Yes.
Okay. So if somebody comes into you, doesn't matter what the gender is, and at that moment, the best thing in your experience and your degree and blah 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 is antidepressants.
Mhm.
What's one thing they can do to help themselves and the doctor? Does that make
Well,
sense? I've just been.
I think you have to explain that the antidepressants is just part of the treatment. Okay, when you have mild depression, you have a 50-50 chance the antidepressants or treatment or talking therapies may be quite as effective. But if it's slightly more, you actually need some chemicals as well. But it is only part of the treatment. So it's a little bit like when you're having your supper. If you have your supper, you don't just have a steak. You can have steak, you can have some potatoes, you can have some veggies. Antidepressants may be a little bit of veggies. The talking therapy is the big steak. And exercise and all the other stuff is all the veggies. And if you have that balanced meal, you will get better, and you will combine all the effort into getting better, and you will get better faster. Okay, yeah. It's a little bit, when people say, "Oh, I don't want any antidepressants," it's a bit like trying to swim with one hand tied behind your back.
Yeah,
you can still do it. It's not particularly efficient and not particularly pleasant, but you can still do it. But if you release that hand and you can actually use both hands to swim, you stay above the water better, you get further quicker.
Yeah.
And it is up for discussion. If you give it a good try and they don't work, the doctor's not going to carry on pressing, giving you something that doesn't work. If after 6 weeks they haven't worked, they either increase the dose or they change them, or they certainly won't give you stuff that doesn't work.
Excuse me, this is getting annoying now. So how many people, I don't know, I'm probably asking you for stats, I'm not. So how many people, especially if it's like their first time being depressed, for example, how many people have gone, okay, I'll do this, and then actually after a couple of weeks, 3 weeks, have gone, actually, I genuinely feel better now, and it's put them back on the right path? Does that happen a lot?
It happens quite a lot, and it is a little bit unfortunate because that's just about when you start feeling a bit better. But if you then stop the medication, it will tail off, and 3 or 4 weeks later, you may feel just as bad as you felt before. Because once you start the antidepressants, firstly, they have to get into your system. Secondly, they have to be in your system for long enough before you can wean yourself off and stay better.
Yeah.
So, for the first episode of depression, if I start somebody on the antidepressants, I say, look, minimum 3 to 6 months on these before we can start looking at reducing them. If it is their second episode of depression, you're looking at 12 months minimum before you start thinking of withdrawing them. And if it's a third or more, I think you should just stay on them.
Yeah. As
well. So that's the current thinking.
Is that where talking therapy? Obviously, I know that's going to open up a can of worms.
No, talking therapies. As a somebody who thinking, oh, I'm a macho man, I don't want to talk about these things. I thought, oh, they're not so good, not so useful. I went through a spell when my mum died, and I took it quite hard, and I was just bottling it up, and that's not good for you. So in the end, I went and had a session with a counselor, and had a session, went through it all, and in the end, I did decide that actually it's not for me.
Yeah.
But at least I gave it a try. And in order for talking therapies, again, quite a lot of it is now online, so you can sort of read the background of it. But rather than quite a lot of therapies are on Zoom these days, I find that it's always a little bit better in person. And when I was looking after sick doctors, I always try to do it in person. Rather than just on the telephone or on Zoom, because it's much more of a rapport, and you can actually see the little nuances in behavior, how they are looking, how they are positioning themselves in the small room. You can actually read that much easier than just on a two-dimensional screen.
So it's all about body language, isn't it?
It is, yeah.
Without question. I think the main thing, the one thing I do know is when we upload this, people, there will be some people like, you can't get any therapy. I'm not sure where I sit with that, because I'm gonna put a disclaimer on this one. I did go through the whole thing of self-referring myself. I've been through that cycle, and my wife was like, pay for it. And actually, I'm trying to be careful, but I don't want to upset anybody. I'm well aware there's people who just can't afford it. But actually, yeah. I'm in a situation where I could afford it, and that was the best thing to do with me. And actually, for me, it's one of the best things I've done personally. I just feel like a comment like that, somebody's going to get upset with that. But yeah,
I think the real problem I find with this is that because the service has been so starved around where we are, there isn't many people who can do it on the NHS, and therefore there are long waiting lists.
Yeah,
and also they can provide just the basic treatment, which sometimes is not enough.
Yeah.
And you may need a little bit more. And in order to access that treatment, you may have to pay for that. And you may have to go further into the county, or maybe even outside of the county, purely because, for example, psychology, well, there's one person in East Suffolk, or two people in East Suffolk that are looking after it. If you find that 25% of people who come and see you need referral to that, no wonder it's a year's waiting time. And quite a lot of the time, you can't wait for a year. If you wait 6 weeks, it's long enough. Yeah. And for example, if you have, I'll look at it from a physical point of view. You have a carpal tunnel syndrome, which means that you can't work your hand very well, and it's really painful, numb, etc., etc. With a waiting list is 11 months. Well, you're off work for 11 months. Therefore, you're on benefits. Now, if somebody would pay for you to have this done, you're off work for 6 weeks, and then you're back at work paying taxes. It's pure economics. So having waiting lists is complete madness, really. And it's the same thing with the psychological illnesses. If you could get somebody to start treatment very, very soon after they've been referred, they get better quicker, and therefore they get back to work, and therefore they're more productive, and therefore they pay their taxes, and therefore everybody's laughing.
Do you know, I generally feel bad for that doctor, because after what you've been saying, I'm just remembering I wasn't asked. I was quite. I don't even know if I was rude or not, actually. And now, after just listening to you and stuff like that, I generally feel quite bad, mate, if I'm honest with you. I can feel your frustration as well, where it's just like, I know if this guy gets that, or woman can get the right treatment with whatever the therapy, it doesn't really matter what it is. Yeah. So yeah. I generally feel your pain on that, actually. But all you can do is use the tools provided.
Exactly. And try to find them if they're not around.
Yeah.
And even, for example, even when the tools are not there, if you then come to talk to your GP, at least you can discuss the options. And it can say, well, if I had this, I would refer you that, but I haven't got that. So the other options are A, B, or C, or A and B and not C. So it's still good to go and have a discussion with somebody who sort of knows the ropes a little bit.
Yeah, absolutely. That was a good call. That was a really good call, actually. Let me just hit that. Let me just hit that record button. Give me 1 second.